Good morning. um, we've talked a lot about the restrictions being balanced with increased testing capacity, as well as continued social distancing, and the importance of contact tracing. So I wanted to take a few moments just to talk a little bit more about contact tracing in detail. So people will know what we're doing, a lot of the legwork that goes behind it, and if we call, what we're calling about. So it all starts with when we're notified of a positive case. And so at this point, we can find out through a variety of sources. It could be someone calls us, we receive an email through a secure email, or we find out from a lab result in the Ohio Disease Reporting System. We then attempt to contact that person and understand when did. So this has changed a little bit over the course of this response. But now we are talking to people about who they were around before they started feeling sick. We ask them for their contact names of people they've been around and numbers. So this is how we find out about who their contacts are. We then call those contacts and we try and find out, are they having symptoms that are consistent with COVID-19? If we determine that that contact is not having symptoms, then we will place that person in quarantine. So quarantine is for people who are well, and they will be in quarantine for 14 days from the last time they had contact with the positive person. If when we call someone they are having symptoms consistent with COVID-19, as Dr. Gullett pointed out about our probable cases, we will consider them to be a probable case, and we will place those folks in isolation. So isolation is for people who are ill, and it doesn't have a predetermined time like quarantine does. So isolation is discontinued after they meet that recovery criteria that we follow from the Centers for Disease Control and Prevention. I think it's amazing when I stop and look back on it to think about in the last 6 weeks, less than 6 weeks, that we've reached out to almost 3,000 people in our area through contact tracing. And through that, we've identified contacts who needed to be quarantined, 2,400 people. And all of that is made possible through contact tracing. And in the midst of that contact tracing, we've identified almost 400 people who were having symptoms consistent with COVID, and we're able to place those people in isolation. That's really important because that means that along with the stay-at-home order, as well as with us identifying people who may not have had the opportunity to be tested, that we're stopping the spread of that in the community from that person because they've limited their movements and we've identified that they probably have a case of COVID. So that's part of why that work is so important. So I also wanted to just stress, as Dr. Gullett discussed, that we understand when we call that people are scared. And in some cases, people are angry. They're confused on how we got their number. But we also want people to understand that when we do call, we're calling to try and understand their risks as well as their family's risks and their loved ones. Because we've seen enough circumstances where it has been spread among family members and among friend groups. And so we want to help track that down and understand who may be at risk for developing it, especially those with underlying conditions who may have further complications. So if someone calls you, we are asking that you cooperate with that contact tracing. We know that there have been scams related to contact tracing, and if people have concerns about that, they can call our main number, which is 216-201-2000, to confirm that the person that's calling is calling from the health department. Next, I would just like to talk a little bit about caring for our caregivers. These last couple of weeks have been very difficult in seeing the human toll of this virus in our community and seeing increasing numbers of death. And that is something as caregivers you carry with you. No one wants to see, those who are most vulnerable being at risk and dying from this virus. It's what we're trying to prevent so hard. And we focus a lot on our long-term care facilities. And I would just like to acknowledge the work of our caregivers in those facilities, in skilled nursing facilities, the doctors, the nurse practitioners, the nurses, as well as the aides, and a variety of aides, including dietary and cleaning staff. Nursing facilities or long-term care. It's not easy on a regular basis, and these folks are leaving their families and putting themselves at risk, and we need to acknowledge that. And they're trying to protect our most vulnerable. In many ways, they serve as surrogate families, and they've approached this with commitment and compassion. And we need to remember that we need to support them. I saw some social media posts the other day of a community that had decorated outside of a nursing facility and just encouraging the workers who are going there. And they need our gratitude and our empathy and our compassion. So last, I would just like to point out some signs of hope. One of the things, I try to stay off social media as much as possible. It can be a little difficult, I guess, especially at this time. But one of the concerns that I see a lot are about us not really talking about those who recover. And thankfully, most people who will get COVID-19 are going to recover. And that is a lot of hope, and that brings a lot of joy. And so, like Dr. Gullett said, we do celebrate the total number of people that we are able to clear. And today in our jurisdiction, having more than 300 is something that we are very happy about. And we're kind of waiting for the 400 mark. I can just note for the first time this week, in the more than 40 since a day where we receive new cases. And to me, that is a sign of hope that we will have more days like that. And we know that it will come in ebbs and flows, but it does give us hope that we're on the right path.